Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Hello, everybody. Let's go ahead and open up that waiting room. Let people in. Hello, and welcome everyone to Daily with Doc. My name is Becca Dukes, and I'm excited to have you here joining us as we have an hour planned for you with empowering information and explanations as to some of the things that people question most when it comes to Dr. Wallach's philosophy and some of the things that he's added to the bad foods list. So it just makes sense to me. Once you hear how he explains this, it's going to make sense to you as well. So thank you, everybody. If you are live with us, make sure you have that chat open as we have Marilyn and Phyllis both putting valuable information and transcribing what is being spoken in the show into that chat, and it's only available here. So folks, if you are watching us on a live stream or a replay and you would like to join us live, you may do so Monday through Friday from 12 to 1 p.m. Pacific time by going to zoom.dailywithdoc.com. Again, that's zoom.dailywithdoc.com. Put that in your URL address bar, and that will bring you right in, but it'll put you in the waiting room. But you want to do it Monday through Friday from 12 to 1 p.m. Pacific time. We start at 12, end at 1, so don't show up at 1:02. My name is Becca Dukes. I am the Director of Student Services for the Institute of the Holistic Health, and also I am a team leader within a company that has provided solutions for almost 3 decades, and Dr. Wallach's been using his formulas for even longer called Longevity. Now, Dr. Wallach started the Longevity company itself. He wanted to make a greater impact than what he could do from the four walls of his clinics. So he decided to create an army. That army has put us on a crusade to save humanity from hurting, from being sick. You know, health care is basically sick management, and he wasn't okay with that. So that is where he has taken his research, his decades of research, put it into these formulas that actually provide solutions to poor health conditions rather than just masking symptoms. And when you're masking symptoms within the body, because the body is not chemical deficient, those chemicals can make additional harm within the body and more breakdown and more issues. So folks, let's get to the root cause of things. Let's look deep into what it is that is causing us to not be able to absorb nutrients with a man who has a Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, where, you know, vets, their patients don't talk to them, so they got to figure it out. He has 3 postdoctorates in pathology, folks. So not only did he have to figure it out, he actually went deeper and wanted to know the reason why poor health conditions existed in the first place. And he was able to connect the dots with nutritional deficiencies to the things that were happening within the body. And most of these bodies had lost their lives, lost their soul. So he took and connected dots from their demise to help us. He also found the first non-human case of cystic fibrosis in a Ricci monkey. Now, cystic fibrosis was said to be a human genetic disease, folks. Not only did he find it in a non-human, he also proved that it was not genetic, and the cause, and also the solution. Well, they didn't like that, so they fired him, but that opened an even bigger door that pushed him to teaching nutrition at the naturopathic college, and then on to become a naturopathic physician. So over the years, he has almost 30,000 autopsies that he has been instrumental either in or reviewing. And that's on 452 different species, including humans. Now, in that stint of doing autopsies, that included 1,700 children in Qishan, China, who had passed away at the age of 10 and below, where he found nutritional deficiencies that caused their demise as well, which cardiomyopathy, heart attacks. Their hearts failed because of a nutritional deficiency. So he's probably going to talk a little bit more about that. But folks, as we're going through today's program, if you can't take notes fast enough, take screenshots of what is being put into the chat, because again, Phyllis and Marilyn do a fabulous job with the transcription. So it is my honor and privilege to welcome to the screen with me my mentor, a man who, when I was at my sickest, somebody shared his message with me, and I am so thankful for that, because that has allowed me to be able to be here with you and have Dr. Wallach in his office on the screen with me as he's looking through his books. Doc, welcome to Daily with Doc.
Well, thank
Folks,
you for the introduction.
Dr. Joel Wallach. So, Dr. Wallach.
Yes, ma'am.
As you're going through your books, we have so many questions that come in regards to the good foods, bad foods list. And there is a grain that they're now putting on the label more and more as being gluten-free. And that grain is oats. So oats is on the bad foods list. Can you share with us why?
Yes, well, oats is not gluten-free. Goats are not gluten-free, okay? And oats, wheat, barley, rye, and oats. And of course, I can remember when I was a little kid, everybody, grandma, the doctors, pastors, everybody was saying, oh, eat more whole grains, it's good for you. Mm-hmm. Well, they kill more people in all the wars, okay? So you got to give up wheat, barley, rye, and oats because it takes those villi, those little finger-like projections in the small intestine, and increase the absorptive surface. Those villi go away, and instead of looking like a shag rug, the lining of your intestines look like a glass tube. So you're down to like 2% of the surface area, okay? And it's really, really a problem. And so the nutrients on the positive side are not made, minerals particularly, are not made by plants. Minerals cannot be made by plants. Some vitamins are made by plants. And back in the old days, 2,000 years ago, 200,000 years ago, people were in certain places, they lived, and this is written up in the Old Testament, the Old Bible, the land flowing with milk and honey. These are people who lived to be 120, 150, 200, 300, 400, 500. There was no doctors involved, no hospitals, no clinics, no prescription drugs. But they were putting their wood ashes or coal ashes from their cooking fires, their heating fires, and their light fires, and so forth. They're putting the wood ashes and coal ashes into their gardens as a fertilizer and into their food as a spice. And of course, when you burnt the wood and you burnt the coal, the powder that was left was in minerals that wouldn't burn. But they didn't occur equally all over the earth. And that's why the land flowing with milk and honey, there were certain places on earth where the glaciers would grind up the rocks on top of the mountains. And the rocks had maybe 50 or 75 or 100, 150 different minerals in them. And when that white powder came down in the creeks down the sides of the mountain, it looked like milk coming down from a half a mile away. And so people say, well, why do these people live a long time? Well, they live in that land flowing with milk and honey. Well, why the honey? All those minerals coming down, more minerals in the valley, more flowers, more bees, more honey. And so Dr. Milan and I, we actually spent, over a year going around the world to places where these lands flowing with milk and honey were classified in the Bible and in modern times too, and documented what was in them. And of course, right now, the longest lived people on earth are in Pakistan. Of all places, Pakistan. They don't have a single doctor in these villages where they have all these people. Who am I thinking about here?
Are you talking about the
Hunzas?
Hunzas?
Yeah, the Hunzas. Yeah, the Hunzas. And the Hunzas, they didn't have any doctors, yet their average lifespan is 120. We have all these famous doctors. They look in the mirror and say, I'm famous, I'm a doctor. Okay. Well, their average lifespan for white medical doctors in America is 75.7. The average lifespan for Black medical doctors in America is 65.7. And that's not very good. That's not a good advertisement to listen to them because they're not doing very good. Okay. They believe falsely if you just eat well, you're going to get everything you need. Well, plants can make some vitamins, but plants cannot make minerals. What happened? Well, at 3 o'clock in the afternoon, Monday, September 4th, 1882, on Pearl Street, New York City, in the bluff overlooking the construction of Brooklyn Bridge, there was a guy who came up with electricity, okay, and he pulled the switch. Who did the electricity thing?
Is that Thomas Edison?
Thomas Edison. You got it. You get an A+. And Thomas Edison, when he pulled that switch, lights went up everywhere, and everybody, or the next 3 or 4 or 5 or 6 months or a year, switched from wood and coal as fuel to electricity. And then all these diseases started. So they had to have hospitals and doctors' offices. Before that, there was herbalists. And the herbalists were, would visit your house and give you a little story and give you some herbs to try and that kind of stuff. But the real heavy duty medical things only occurred after they made the mistake of going to electricity. No more access to the wood ashes. Wood ashes only have the wood ashes, depending on where you were. But now the fertilizer that farmers use, because they don't have access to wood ashes anymore, the fertilizer used only 3 minerals, because plants only require 3 minerals, whether it's an oak tree or an olive tree or a carrot or cabbage. Okay, they only need 3 minerals. We need 60, the 90 essential nutrients, 60 minerals, 16 vitamins, 4 acids, 3 fatty acids. And so this is very obvious to me. And I'm working my way through veterinary school in the pathology lab, and I'm seeing all this pathology. And these are from rich people and educated people, and they're all dying of all these nutritional deficiencies. How can they be? Well, they're eating well, but they weren't getting enough nutrition because plants do not make minerals. And so that was a big education for me. And I wrote many, many articles and many books, which became textbooks for veterinary schools, agricultural schools, medical schools, pharmacy schools. Very, very proud of that. And of course, the average person on the street can buy these books too. This is why we started the longevity business, okay? Because we had to begin to make this information available to the average person on the street, because the medical system was failing them terribly, okay? And insurance would pay for their bills, but they would still die, okay? That was very, very scary stuff. And so I came out, I think I've got like 27 best-selling books now. I got a couple of more in the pipeline. And we have a lot of CDs, over 100 CDs. We have, I don't know how many dozen DVDs. We have a new one out. This one, okay, is available now. Okay. And it talks about the AI. Okay. AI has been around for a long time. AI, we're talking about artificial intelligence, okay? And it goes back to fences. If you sleep all night and all your cows are inside that fence, you didn't have to be out there keeping the cows in your backyard, because the fence did it for you. And now, we have things since the electricity came out. We had timers on cooking devices, okay? And then, of course, we had for heat and cold, if you had your thermostat set for 75 and the temperature would drop outside to 60, it would click on, when you're asleep, it would click on and bring the temperature up above 75 to 78. If it was too hot, it would click on and turn on the
cooler,
ice,
the air conditioner.
The air conditioner, there you go, the air conditioner, and bring the temperature back down to 70, 75. And that was AI, artificial intelligence, because you didn't have to be there. You're asleep, you're someplace else, and all these electronics are doing all these things for you, okay? And so what happened? Well, when it came to treating people with prescription drugs, that was the big failing of the medical system, because the prescription drugs just treat the symptoms, don't actually get down to the basic root cause of the problems usually. Okay. And so this is why AI was able to creep in. But let's say nobody ever has one symptom. Let's say you have diabetes, you have high blood pressure, you have abdominal obesity. That's the metabolic syndrome. 35% of American adults, both men and women, have the metabolic syndrome. 35%. It's a very simple series of nutritional deficiencies. Okay. Well, what happens is they will treat the high blood pressure, okay, with high blood pressure medication. For the diabetes, they will give you diabetic medication, okay? And for the abdominal obesity, they will give you medication to help you lose weight. But they're failing because they're not getting the basic root cause of the problem. They're just dealing with the symptoms, okay? And so this DVD, okay, really was initiated because of our association with Charlie Ward, one of the biggest news and conference radio guys in Europe, okay? And he kind of liked what we were doing. And he said, can you do something on AI? Well, that set this all aflame, okay? And so now all through Europe, this little CD, okay, it's only like a half hour. I think it's like 28 minutes, but it covers all this. So we have to not only go after the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. We also have to deal with the symptoms. We also have to deal with that disease. So you're going to be taking the Healthy Brain and Heart Pack, which gives you the 90 essential nutrients. And then we have the catalogs with over 100, actually 2,500 products to deal with 600 different diseases. That's in addition to the Healthy Brain and Heart Pack and the Healthy Start Pack. And we also have the Healthy Bone and Joint Pack, and then we have all these different ones. And of course, some of my books were outrageously popular. One of my most popular ones is Dead Doctors Don't Lie. And before the book itself came out, yeah, there you go. Before the book itself came out, I had a
your lecture.
Yeah, they did.
You had a cassette.
They didn't have CDs back in those days. Okay, but they did have audio tapes. We sold over 40 million of my audio tapes by the title of Dead Doctors Don't Lie. So they said, well, turn it into a book. So it became a book, and people just loved it because it's going into all the things you need to do to survive and prevent these diseases, get rid of these diseases. And then we came up with a DVD. Okay, this is 2 hours and 8 minutes long, and this was filmed by professional movie theater film crews. This DVD. This is one of my best, what should I say, DVDs.
And that is also called Dead Doctors Don't Lie. So, folks, that is one of the greatest health lectures ever recorded. You definitely want to get
this. That's right. It's on here. This is it. Okay.
That's it.
And then, of course, we have now we've got the Dead Doctors Don't Lie CD. Okay, that's available now. We've sold over 20 million of those.
And the CD is actually translated into 9 different languages, Doc.
Wow.
That's pretty awesome.
That's awesome when you think about it. Okay. And then we have Let's Play Herbal Doctor. And the CD that goes along with that one, Let's Play Herbal Doctor, there you go, is Dial MD for Murder. That sounds kind of cruel, but when you read the book, The Wallach Revolution, and you listen to the CD, The Wallach Revolution, and you look at the book, it's all in your head on page 6. There we go. Page 6, it goes to top picture on page 6 is the normal skull. It's a 1/4 inch thick. The bottom skulls got osteoporosis.
I got it for you.
Okay, got osteoporosis of the skull, and the osteoporosis is squeezing the 12 pairs of cranial nerves. You can flip the page, and there's the brain and 12 cranial nerves going to the tissues that they go to, and it tells you on the next in the adjoining page. There you go. A white streak, a gray streak, a white streak, a gray streak. Each one of those streaks is a chapter in this book, and it tells you what nerves go to what tissues and what you need to do to treat it and get rid of it. And all these things will go away. And of course, to our program today, we have also gotten a CD.
Mm-hmm.
A CD that goes along with it, and the CD is it's all in your head. Okay, how to prevent osteoporosis of the skull and the spinal cord. Okay, osteoporosis. This is very, very great little CD. It's all in your head, just like the book. And then we have Hell's Kitchen. Here's another one. Goes in all these terrible diseases and the different nutrients that are missing when you get these diseases. And there's a CD that goes along with it. Okay, the CD is sort of a miniature summary of the book Hell's Kitchen. Okay, and you read page, or excuse me, chapter 14, it'll blow your mind. It has all the diseases that occur because of misinterpretation of what's going on and bad prescriptions and so forth. I mean, I could go on. I got 27 best-selling books here. And so it's one of those things where this is available to everybody. And so I want to make sure you're going to give out a number, and I'm going to give out a number. The number I'm going to give out is 1-800-755-4656. That's 1-800-755-4656. And you go ahead and dial that during business hours, and they will take your order. And of course, if you pay the regular price for the books, or different prices based on the books and the size of the books and the information. And when you buy 8 or 10 of them, it depends on the books, you get a nice discount, so you can buy 10 of them for the price of 8. Okay, when you buy 10. Okay, and so these things will give you the information. Now we want to get to the subject of the day. Okay.
Well, Doc, yeah, I want to circle back around to oats. Okay, so oats are very susceptible for cross-contamination. Most of the time, they are manufactured in the same manufacturing facility as wheat, barley, and rye. So they got the cross-contamination from the gluten in those other grains. But oats themselves don't have quote unquote gluten. They have, is it avein and gliadin? What about those proteins, Dr. Wallach, make it bad even when it says gluten-free?
Well, gliadin, okay, is kind of like, what's the difference between a 22 bullet and a 22 bullet? You know,
so you've got a 22 short, you got a 22.
Yeah, there you go. 22 short and 22 long rifle. There you go. And so one of those things are, so there's obviously a piece missing in all this. So we came up with the flip chart, which is, I don't know, I think it's 76 pages, something like that.
Yeah.
And it's full of famous people. We have helped them get rid of their diseases. And most of the diseases that their medical doctors or famous medical doctors couldn't fix were myelin deficiency diseases. Okay. Now, why were they all these famous people? We're talking about movie stars. We're talking about famous athletes. We're talking about famous wealthy people and famous doctors, famous politicians. Why are they all getting sick and dying, okay, of things going on in their brain, that they're losing the myelin in their brain? Well, that's because doctors were telling them to give up something that was very, very bad for them because it was bad for their heart and their arteries, which wasn't true. Okay. They're saying cholesterol is bad for you. Well, if you fry it, cholesterol is bad for you. But cholesterol is your best friend. It makes up 95% of your sex hormones. Whether you're a woman, you need it for your female sex hormones. If you're a male, you need the cholesterol to make male hormones. And if you stop taking it because the doctor says it's bad for you, everything in your life goes bad after that. Your sex hormones aren't there anymore.
Well, and oats are said to help lower cholesterol levels. So even though when people eat them, they get bloated and they feel crummy, they're still eating it because it's said that it's going to help to lower cholesterol levels. And you're saying, Dr. Wallach, that cholesterol is good?
Cholesterol is good. Now, I didn't finish. Cholesterol also makes up 85% of the white matter, the myelin of the brain and spinal cord. So it's required for your sex hormones, it's required for your brain and spinal cord. And in my books, you can look up a disease.
Yeah, Let's Play Doctor is a really good one for that one, Doc.
Yeah, okay. Let's Play Doctor.
Look up the condition.
Yeah, there you go. And of course, it's one of those things where we have a CD for that one too. Let's Play Doctor, right? And it's one of those things where it teaches you how to diagnose. It teaches you how to choose a treatment. Okay. And we're talking about a diet to get rid of the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. Well, what do I drink for energy if I can't have a carbonated drink? Well, that's what we came up. We came up with the rebound, no carbonation in the rebound. There's 30 of these sticks. It has all the vitamins you need, all the minerals you need. Okay. And it's really, really has amino acids in it. I take one of those, say, before breakfast and one of them again before lunchtime in the afternoon. So I need to get 2 boxes a month because there's only 30 sticks in a box. So I have to get 2 boxes a month. I have to pay for them like everybody else. I don't get this stuff for free. Well, it became obvious over the years that medical doctors were going off in the wrong direction, and the customers, the patients, were getting the wrong end of the deal. So in this book, the flip chart goes into so many common diseases that doctors have missed terribly. Okay, 90 for Life crusade to save humanity and the earth and the world. Okay,
The world.
the world. Because it's not only the earth, but also the oceans and the mountains and okay, and the forest. But these page 24, 25, it depends on the year that you buy it. It's either on page 24, 25. And basically, it goes into these diseases that are caused by a myelin deficiency, the white matter deficiency of the brain, because you're getting all this medicine to get rid of cholesterol, or you're consciously avoiding cholesterol because your doctor told you to stop taking cholesterol. Okay, and you're paying a damn price. Okay, Alzheimer's disease, Parkinson's disease, multiple sclerosis, amyotrophic lateral sclerosis, Huntington's, chorea, frontotemporal dementia, Bell's palsy, cervical spondylosis, optic neuritis, Charcot-Marie-Tooth, Guillain-Barré syndrome, neuromyelitis optica, myelin oligodendrocyte, cycloprotein antibodies, okay, transverse myelitis, disseminated encephalomyelitis, okay. And then, of course, we also have, let's see here, fatigue and vision loss, muscle weakness, muscle stiffness, loss of coordination, walking problems, change in sensation, nerve pain, change in bladder and bowel function, overall fatigue, uncontrolled body movement, difficulty in swallowing, changes in speech, mood, depression, anxiety, irritability, blood pressure, heartbeat, palpitation, the list goes on. 50, I don't know, maybe 60 diseases are caused by demyelinization, which is a cholesterol deficiency. It's a cholesterol deficiency. I don't know how else to say it. Okay. Now, it's one of those things where you have to say, okay, I'm looking at all my family and they're doing everything the doctors say, and every one of them are getting the same problems. Okay. So I'm going to try and do something Wallach is saying. Okay. We have literally millions of people all over the world who are doing what I'm saying. I mean, we're in, I don't know, 81 countries. Okay. And many of them, again, just like this new CD, you know, this new DVD that's out, okay. And it goes into the AI, because what happens is when you go to a doctor and you have all these problems, you know, like when you have things like metabolic syndrome, you have abdominal obesity, you have high blood pressure, and you have diabetes. Well, the doctors will treat the diabetes with giving you injectable insulin, okay, or giving you pills to help lower your blood sugar, okay. But and he's treating the symptoms because you're not getting to the basic root cause of the diabetes, which is a nutritional deficiency. And that's why we came out with the sweeties. Sweeties, okay? And it's one of those things where you have to appreciate that when you deal with this, the other things are going to kill you. The things you didn't put a lot of effort into, you're just dealing with that diabetes. And the high blood pressure can kill you. The abdominal obesity can kill you. And so this is why we came out with this CD on AI, because medical doctors, and I get breathless when I think about it. Okay. Hell's Kitchen, that's why we wrote Hell's Kitchen. And also, Let's Play Herbal Doctor. Okay. People are pretty smart. And they read what's going on in the newspapers, and there's all these articles in the newspapers about how many thousands of people are killed. You should see the word I use. There's thousands of people killed each month in America in hospitals and clinics. There's thousands killed each month in hospitals.
That's a lot. That's a lot, Dr. Wallach.
Well, there's thousands. And we give you examples that are in the newspapers, okay, and also written up in the medical journals. We'll give you we'll give you the article, whether it's a medical journal or newspaper, and we give you what happened over a period of a year in this particular clinic, how many people died from this thing, okay, or died from another thing, or you'll have, say, 500 die from one disease in this clinic, you'll have 1,200 die from another disease in this clinic, and the doctors are not harmed because insurance pays. Insurance pays.
So, Doc, I don't think doctors themselves are to blame. It's Mr. Rockefeller that is to blame, because he took control of pharmaceuticals, which then took control of what's being taught in medical school, which then limits them from being able to do things that actually address underlying causes.
Okay, well, here's the problem.
I'm on my soapbox on that one.
Okay, well, here's the problem. And here's where doctors fail the patient. Let's say you have diabetes, high blood pressure, arthritis, you got ringing in the ears and balance problems and all that kind of stuff. And you have some constipation and you got kidney issues. And he's only going to treat the diabetes. All the rest of it, he says, just eat well, stay away from all the bad foods, and this other stuff will kind of quiet down, come under control. And then, of course, the patients will live 2 more years, but insurance paid for the healthcare costs and all that kind of stuff. And people think that's the way it's got to go. Well, it goes that way because the doctor is only treating when he knows he can treat. You have 5 diseases and he's only treating one, and he wants you to change your diet, get rid of all the bad foods. But
he's not telling you to,
huh?
Doc, as far as diet goes, they're just addressing symptoms.
Yes.
Many of them aren't even making dietary recommendations. And actually, I have seen the recommendations after heart surgery, and they're still recommending things not to take. Would be certain vegetables and fish oils and certain fishes that are natural blood cleaners. And it just, burns me, Doc. It actually upsets me what they are recommending, because they don't want to have their pharmaceuticals work better to the point that they don't need them anymore. And many of the things that you just mentioned, Dr. Wallach, are side effects of those pharmaceuticals.
Yes, and the pharmaceuticals, if you're pushing all the efforts into getting rid of the diabetes, the pharmaceuticals for diabetes aren't going to help arthritis. They're not going to help high blood pressure. They're not going to help things that go on in your back and your cartilage and ligaments and tendons and anemia and all that kind of stuff. And they say, well, you just have to suffer with that. Just eat well, stay away from the bad foods. And it's just not good enough. And so this is why we came out, especially when it comes to the brain, we came out with the 90 for Life crusade to save humanity and the world. Okay. And this is one of the tables, and I think there's 2 issues, 2 different, about 3 years apart. Okay, so the page will be a page or 2 different because we've added things as we went along. But these are all the diseases, okay? Well, I shouldn't say that. These are many of the diseases that occur when you're reducing cholesterol out of your diet and you're eating all the bad foods and you're taking your medication for symptoms, but not getting rid of the problem, okay? And so I have so many people, they call me up, say, I just, got that flip chart a couple of months ago and started doing the diet in there. And in 2 weeks' time, I got rid of my diabetes that I had for 25 years. My doctor said it was a genetic thing. No, it's just a nutritional deficiency thing. And it's one of those things where, again, when it comes to the brain and stuff that goes on with the brain, There's one just a couple of days ago. I think it was Friday. Okay, a couple of days ago. There was a big story on Fox News. And they didn't give a telephone number or a state where this was occurring, but there was twins. These are not identical twins, but twins. Okay. So their genes are a little bit different because they're not identical twins. And one of them had a disease called Friedreich's ataxia. Friedreich's ataxia. And they can't stand up. They have to sit down. They can't stand up. And as they get older, obviously it gets worse and worse and worse and worse. And they usually die in their teens and that kind of stuff with Friedreich's ataxia. And I spent a lot of time on Fox News trying to find a way to get a hold of that family, because if they were to get off the bad foods, get on the good foods, and these are now teenagers, so they could have the healthy brain and heart pack, okay, and also take the what should I say, the healthy brain and heart pack, all of the stuff necessary, I-26 to regrow the myelin, the white matter of the brain and spinal cord. And that twin that has the Friedreich's ataxia, it would go away. But I couldn't get through to them. So that's why I'm glad maybe somebody will hear this and know who those people were and where they're from, because they didn't give a lot of details. They just had that in there for a couple hours and went back and looked again. It was gone. Okay. So I don't know if they had too many calls or they didn't have any calls on that one. So it was only on Fox News for a couple hours and then it was gone. But
Wallach,
yes.
We have some hands up and we definitely want to make sure that we get some questions answered.
Okay.
And folks, there's so many different things that are nutritional deficiencies.
Yes.
So many things. In fact, Dr. Wallach, you discovered there's over 600 different poor health conditions that are directly linked to nutritional deficiencies.
That's correct.
So we have a question here
that I was nominated for the Nobel Prize twice. Received the Klaus Schwartz Award. Received the Lifetime Achievement Award from the United Nations. So people in places of authority recognized the work we were doing and that we were correct.
Absolutely. Absolutely, Doc. So we have Slava. Slava has a question in regards to their 74-year-old mom who was diagnosed with glioblastoma, which is a tumor on the brain. Symptoms include things like headaches, nausea, vomiting, blurred vision, trouble speaking, seizures, personality changes, altered sense of touch. Dr. Wallach, they're saying that there's large lesions in both hemispheres, not resectable, but they're wanting to know, what are your recommendations, Doc?
First of all, they need to get a hold of a couple of books. They need epigenetics. Get the book Epigenetics, because this is not a genetic thing. This is actually a very simple nutritional deficiency. And you just
go ahead and put that down, Doc, if you would, please, so it's not muffling your voice.
Just like those twins, okay, that had, one of them had the Friedreich's ataxia, and the other twin didn't have it. Well, they're in the same household. It was just a simple nutritional thing. How come? Well, kids are different. One kid won't eat something. The other kid ate more of something, okay? And so the differences in their eating patterns is why one got the problem, the other didn't get the problem, okay? And so what was the genetic thing? It was food choices. It was food choices. And so this is where the parents and grandmoms and dad and uncles, they really need to say, okay, if you want to go to the movies, you have to eat these things and take these pills and these liquids and everything. And if you leave one out, you don't get to go to the movies. You have to make sure they're going to take everything. And then the brain will take care of itself. We can rebuild, the brain will rebuild. You give it all the 90 essential nutrients, you give it the cholesterol, it needs to rebuild the myelin of the brain and spinal cord. And it's unimpeachable evidence. And Dead Doctors Don't Lie, the DVD, Dead Doctors Don't Lie, the CD, Dead Doctors Don't Lie, the book. Millions and millions and millions of people. That book sold 347 million copies. I don't even know how many, it's in 81 countries, but I don't know how many languages it's in. Okay. For instance, they're printing some of my books in England, and they're all printed. They had 3 months of printed books and selling them. They were supposed to send me checks. They couldn't send me checks because, they're having a strike in their postage thing.
Oh my goodness. Well, that's in Canada. So that's going on in Canada, Doc. So definitely that'll be something that will be eventually rectified. But Dr. Wallach, you have poured your heart into this research. Not only did the research, but also created the books, wrote the books, so that you and I, folks, each and every one of us, have the opportunity to get this information. Now, Dr. Wallach mentions the good foods, bad foods list. You can find that on our website, dailywithdoc.com. You'll find a good foods, bad foods list. But because we are a resource for an amazing community, I want you to make sure that you get back to the person that shared this program with you and tell them thank you. Ask them your questions, because chances are, because they're referring you others. Oh, and you can also find it on the back of the book, Metabolic Syndrome, that Dr. Wallach is holding up as well. And also in the flip chart. I've made sure that that was on the back of this book and also in the flip chart, as I was honored to be part of the creation of both of those publications. But get back with the person that shared this program with you. They cared enough about you to share it, care enough to say thank you. And they are going to be your initial and point of contact when it comes to helping you figure out what it is that you need in order to go from survive to thrive or reach your optimal best. So, Dr. Wallach, in this case with the glioblastoma, you mentioned the brain and heart pack. You mentioned the selenium, which is what your research selenium got you the award in 2011. Mm-hmm. So extra selenium, the I-26. So that's also going to help with digestion, not just give you the good stuff for the good cholesterol to help support the protective coating of the brain and the myelin, but it's also going to help with digestion. Ultimate Daily Classic, that's going to help with circulation and blood flow through the body itself, including the brain. So what else, Dr. Wallach, would you recommend for somebody if they're experiencing the glioblastoma?
Well, that's where I would start because, again, this is something that's not it's not a cancer that's going to go from the brain to the lungs or anything like that. This is a tissue breakdown because it's not getting the nutrients it needs. Okay. And so they're trying to give anti-inflammatory drugs and that sort of stuff. And it'll reduce pain, but it won't regrow the myelin. They didn't, and they said, oh, stay away from cholesterol. It's bad for you. And they'll stay away from cholesterol. You can't regrow the myelin. And so it's one of those things where this is why we wrote the books and the CDs and the DVDs to get that education out there. And we know we're not going to save everybody because some people say, well, I asked my doctor and he told me just to throw the book away. So I threw the book away. Okay. So that's, be a percentage of that going on. And so we're looking for those who really want to step out of the box.
Medical model.
Yeah. Yeah. Step out of the box and go to where we have so much research done, okay, on these projects, thousands and thousands and thousands of people involved, and it's in 81 countries. And so this is why we have been successful in getting the information out there, because if people aren't going to utilize our information, why beat yourself to death? Okay, we've been doing this for 75 years, and the number of people getting involved gets more and more and more and more. And
Absolutely, Dr. Wallach. So what you're saying is, the medical community, they want to use chemotherapy and radiation, which
yes,
basically poisons and kills the cells. You're saying let's build up the cells so that they don't get sick in the first place, or have the opportunity to
heal
become
themselves.
well again.
Yeah.
Support the immune system so the body can do what it's designed to do with the regeneration of healthy cells.
And now that includes the brain. The brain can rebuild itself given the right materials. Okay. But you can't eat egg. You got cholesterol in it. Well, you're going to have a problem. That's why I came up with the I-26. I like the chewables. I like the French vanilla. We also have, let's see here.
Powder.
Well,
there's two different forms of powder flavors.
Yeah.
And capsules.
It also comes in banana coconut, which is our best-selling one.
I prefer the vanilla personally, because I'm not a coconut kind of gal. But is the same hold true, Dr. Wallach, when we're looking at individuals who have seizure disorders?
Yeah, same thing with seizure disorders. Seizure disorders are a biochemical thing. It's a nutritional deficiency. Okay. And so many, again, and when you look at this flip chart, and there's about 5 or 6 pages of flip charts, and when you talk about all kinds of
Well, in that flip chart, Doc, we only have a few minutes, but also in that flip chart is a story of Danny Glover, an American actor who used to suffer from seizure disorders until he looked at the nutritional approach and joined with Dr. Wallach and his program. So it's absolutely possible to overcome seizures.
Yeah, and of course, thank you for that, because Danny Glover and I, we went around the world several times giving presentations on health. And so we do have to thank Danny Glover for that. And
absolutely.
And so thank you for bringing that one up.
Thank you, Doc. And let's go to some questions, Doc. So I know Phyllis has a couple of them. Phyllis, what questions are you bringing into the show today? And go ahead and unmute yourself, my dear.
Hello, Dr.
Hi.
Wallach.
How can we help you?
I have 2 questions for you. One is from Pat on YouTube, and we don't know if Pat is a man or a woman. We suspect Pat might be a man. Pat says, how do I regain my motivation? I don't want to do anything.
Okay. Well, first of all, you got to get rid of all the bad foods, things that irritate everything, including the brain. No fried foods, no processed meats, no oils, no gluten, no wheat, brown, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. And then per 100 pounds of body weight, he or she needs one healthy brain and heart pack per month. If they weigh 110, 120 pounds, a half a dose of breakfast, half a dose of dinner. If they weigh 130 pounds or more, I weigh 142 and I take 2 doses a day of the healthy brain and heart pack, 1 dose of breakfast, 1 dose of dinner time. I need 2 healthy brain and heart packs per month. I also take the I-26. I like let's see here. I like the ones that have the
chewable.
Yeah, the chewables. I guess they call it the chewables. The French vanilla is the one I like, and so I take 3 of those at breakfast and 3 at lunch and 3 at dinner time, and it protects the brain from falling apart, because doctors say don't eat cholesterol, and people think cholesterol is the worst thing in the world. Cholesterol is your best friend. Makes your sex hormones, and so that's why we have the let's see here. We have the Zero test for males. We have the Zero Fem for females, and the reason why we do is because we have all these kids who were born messed up because the mothers weren't getting everything they needed before they got pregnant. Okay, they didn't start taking supplements until 3 months into their pregnancy, and the embryo, okay, got problems, and so back in the old days, when a male horse would try to breed male horses, they would just kill him. When a male bull would try to breed other male bulls, they would just kill them and eat them. And so in humans, when that happens, they cut your organs out and give you hormone injections. Okay. And so it's one of those things where this is all preventable. This is not a choice. This is something that happened before conception. The mother was not getting the right things for at least 3 or 4 or 5 or 6 months before conception. And the baby, when it was born, was not getting the herbal rainforest. Okay. The baby wasn't getting the kids toddy. Okay. Kids toddy. You need to be getting kids toddy. And we need to pay attention to these details. We won't have this mess. And families break up because the little boy, he's all physically boy, thinks he's a little girl, and they don't want to do the operations, which is thankful. Okay, don't want to do operations on the kid, and they don't want to give him vitamins and minerals. No, it won't help. He's thinking wrong, blah, blah, blah. And so this is where we have to teach as many as we can, and you build up a population of people who are getting the things right and things going right and getting fixed. And so within 3 months, 6 months, 9 months, a year from now, we won't have all this misbelief because we will have solved the problems in enough population that people will pay attention to what we're saying.
Doc, that sounds really good. I have one more question. I know you're short on time. Anthony asks, is it enough for a 50-year-old to take the 90 essential nutrients?
Are you saying 50-year-old or 15-year-old?
50.
50, no. You got to do the diet. Got to stay away from all the bad foods. Take the 90 essential nutrients. Take the Healthy Brain and Heart Pack, or the Healthy Start Pack is another option based on finances. You can take the Healthy Bone and Joint Pack. It's a Healthy Start Pack with our glucogel added to it. Okay, it's a Healthy Bone and Joint Pack. And so there's all kinds of things you can take, and this will give you everything you need to meet your needs for the 16 minerals, 16 vitamins, 12 minerals, and 3 fatty acids. If you don't deal with that, you're going to pay a price.
So besides the essential nutrients, we also need to know what else is going on with that person as far as
you need to get rid of the bad stuff. That's right. You need to get rid of the bad stuff. And this is why these books are useful. Hell's Kitchen. Let's Play Herbal Doctor. Dead Doctors Don't Lie. Let's Play Doctor. Epigenetics. All of these touch the Wallach Revolution. All these touch on the bad things you have to get rid of, as well as doing all the good stuff. Doctors just say, just eat well, you get everything you need, and take this product and you'll be fine. And then 2 years later, they die.
You can't just take the products and figure you're fine. You've got to do the whole lifestyle.
That's correct. That's correct.
All right. Thank you so much. I'll get back to you, Becca.
All right. Thank you so much, Phyllis. And Dr. Wallach, there's one more question that is being asked, and that has to do with the minerals. So are there any ill side effects of taking minerals?
Well, I assume, obviously, if you take too much, you get diarrhea. Okay.
Okay. People need to be cleaned
You'll know
up
pretty quickly if you're taking too much, because you'll get diarrhea if you're taking too many minerals. Okay.
That's right.
Okay, and that's the only thing? So that's it? Am I freezing up?
Yeah, you're freezing up.
Yes. All right, well, I guess it's time to go. So folks, thank you so much for joining us here on Daily with Doc. Get back with the person that shared this program with you. And folks, if there is no one to thank, give our team a call at 855-949-3377. Just a reminder, this program is not meant to take the place of your primary care physician, nor is it meant to treat, diagnose, or cure any disease. But folks, when you give the body what it needs, the body itself can do some amazing things, as Dr. Wallach has researched and proven time and time again that majority of diseases are not genetic. There are a few things that make up your genetics, but disease is not part of that. So join us again tomorrow as we bring more information to you with Dr. Joel Wallach. And if you want more information on how you can become a certified holistic health coach and help others and have the knowledge to help others, go to coachwithdoc.com. That's coachwithdoc.com. And you'll find information on the Certified Holistic Health Coach course offered by the Institute of Holistic Health. And if you want to save 50% from now until Christmas, you may do so by giving us a call or getting back with the person that shared this program with you and ask for the discount code. Our number is 855-949-3377. So today we have on with us, in addition to the amazing Dr. Joel Wallach, our co-host team consists of Sherry, who is part of the tech team, who is very instrumental in making sure that the streams get set up so that we can have the live streams and the replays on all the different platforms. Thank you, Sherry. We have Marilyn and Phyllis, because I'm low connection, whatever, who are very instrumental in making sure that the information is being put into the chat so that people can see it, take screenshots of it. And also Phyllis is bringing questions in from the different platforms. Thank you both, ladies. We appreciate you so much. We have Ruth Ellen, who is the executive production manager, helping to keep everything organized here. Thank you, Ruth Ellen. We have Rod, who is letting people in today and also bringing in questions. Thank you, Rod. And we have AJ, who is instrumental in making all of these different platforms with our show available to meet you where you're at. So again, join us Monday through Friday from 12 to 1 p.m. Pacific time at zoom.dailywithdoc.com. My name is Becca Dukes, and it is my honor, privilege to share what I found to be the missing link in my own health with you and all that you love. Have a wonderful day, fabulous day, and you are your best health authority, folks. Don't forget that. Until next time, bye for now.
Okay, bye-bye, everybody. Thank you, Becca.
Thank you,
Becca.
Doug.
Bye-bye, everybody. Thank you, ladies. Thank you, gentlemen. Bye-bye.
Bye-bye. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health. Dr.